Good afternoon, George. It's Tuesday afternoon, and we got a great episode of the Pediatric Lounge coming to you today.
Yes, today we have Dr. David Hill. The topic that we're going to be discussing today is the day in the life of a pediatrician that's running for Senate. Should be interesting.
Dr. Hill is a good friend, fellow pediatrician, and podcaster. We also share a love and passion for one of the most beautiful beaches in the U.S., Wrightsville Beach. He has a distinguished career as a pediatrician, a leader within the American Academy of Pediatrics in Chicago, the talent behind their flagship podcast, a proud father of five grown children in North Carolina. In addition to this, he loves cycling at the outdoors. I was hoping we could do this podcast together from Wrightsville Beach, so I had an excuse to visit. But unfortunately, I got pulled back into clinic, so we have to do it over Zoom. Welcome, David. It's a joy to see you.
Thank you, Herb. We're halfway there. I am technically in the town of Wrightsville Beach as we speak. One of us can really enjoy it.
David, why did you become a pediatrician?
It's hard to explain without going to my dad, but saying that it's because my dad oversimplifies things a little bit. My dad is a pediatrician. He still practices. He just got back to 4 days a week at age 82. So he's partially retired now. But I grew up around pediatrics. I helped out in the office. I collected urines. I cleaned exam tables. I followed him around the hospital. And I did get a pretty good sense that I wanted to do something in medicine. But initially, I thought not pediatrics. Like it seemed to be, I heard that it was the lowest paid specialty. I did some work during college in surgery. And I thought, okay, you know what? I'm going to be a doctor, but I'm not going to be a doctor like my dad. I'm going to be a surgeon. I actually decided I'm going to be a brain surgeon. And so I did all my research in neurosurgery. I tagged around after our chair of neurosurgery at the University of Texas, Houston, now the McGovern School of Medicine. And I did an acting internship back in Memphis under J.G. Roberts, who's chair of the Sims Murphy Clinic. And after a month, and it was a great month, by the way, I really enjoyed it. But I recognized that I wanted to tell people I was a brain surgeon more than I wanted to actually practice, right? I didn't enjoy the physical act of doing it. I just wanted to say, dude, I'm a brain surgeon and have people be impressed. You can't live like that. So I came back with sort of a crisis and thought, what do I enjoy if this is not what I enjoy? And I realized tagging around after the med peds people, they were my heroes. Like they were the people I enjoyed working with, talking to, looked up to them. I thought, okay, maybe I'll be one of these people. So I got accepted to the MedPeds program at Chapel Hill, which kind of blew me away. I figured there's probably a clerical error involved there, but I took it and practiced MedPeds for a couple of years after I got out. And then we moved here to Wilmington with my wife at the time, completed a nephrology fellowship, and there just wasn't a MedPeds job in town. And I was clawing at the door. I didn't come here with a plan. I'm like, okay, I got to do something. I was taking care of the kids, which was fun, but I was like, I got to do something. So I just wandered into this office of a local pediatrician and said, hey, you got anything for me? Can I help out? And he's like, yeah, come on, David, we'll put you to work. And after my first week helping out there, my wife said, I don't think I've ever seen you this happy. I've never seen you come home from work smiling like this. And I was like, you know what? You're right. And so I just stayed. In 2008, it came time to re-up my internal medicine boards. And I realized, yeah, I'm not doing it. And I don't really want to do it. I love what I'm doing. You guys know you're tapping into a very elemental joy, human existence. We love taking care of kids. It's why we have a species. And so, yeah, I go in every day and I get to use my brain and think, and I get to do this thing that's inherently joyful. And that to me is just the best way to live life.
Well, what a wonderful story. And then what did you find most challenging about your clinical career? Did you transition from what we call now the officist career to a hospitalist?
Yeah. Yeah.
So, what did you find most challenging about being a pediatrician?
You know, in terms of being a pediatrician or being a
Yeah,
pediatric hospitalist,
just a pediatrician.
I think the same things that everybody touches on in that question. When you're navigating a pediatric visit, you never have just one patient. You got the child in front of you, you have family members, you have an environment. And as an internist, I had one patient in the room. Maybe I have a spouse and I'm dealing with that person. But when you're practicing pediatrics, you're always triangulating all the people in the room and trying to attend to all of them, what their needs are, what their concerns are, what brings them joy. And that can be a bit of a juggling act, right? You're like keeping track of all these people and watching and listening. And I think as pediatricians, we work very hard at being incredibly attentive to our patients, the parents, the family members. And so that's a job, right? And when people who are outside the profession say, oh my God, I could never deal with the parents. To me, dealing with the parents is one of the great joys of doing this job. That is, can it be challenging? Sure. But that's another person I get to meet and another person I get to interact with. And I get to see how this relationship is working. And what are the strengths? What can we emphasize here that's going great? Where can I share in this person's joy in their child and their child's development? So to me, yes, it's challenging, but it's also part of the challenge that makes it so much fun. I think the other thing that always makes pediatrics challenging is, as I tell people, it's almost always fun, but when it's not fun, it's really horrendously not fun. And there's something different about shepherding an adult through the final stages of their life than there is about losing a battle with a disease for someone who's just beginning their lives. And I don't think I ever will or ever should get to a place where that doesn't affect how I feel for a very long time. It doesn't happen often. But I think all of us can think back to cases that didn't go the way we wanted them to go. And I think those always sit in our hearts. We're always questioning, gosh, did I do everything I could have done? And it's immensely difficult when we lose or have a bad outcome with a child. And that's part of what comes with the territory. The stakes are extraordinarily high and no day is perfect. Things happen and it's rough.
And for in pediatrics, we fix most problems.
Yeah, or they fix themselves with that. It's a great job for a lazy person. You stand back, they get better. It's all good.
Yeah, so I loved internal medicine, but to me, it was very frustrating seeing the trajectory of the middle-aged male. It's hypertension or obesity, or they start becoming pre-diabetics and they don't want to take care of themselves. And then you're on call and it's 2 a.m. They're having a massive heart attack and they're crying like, baby, save me, please save me. And we've had 20 years of illness.
Yeah.
You've been told this is the outcome. And now here we are trying to get the water out of the boat with teaspoons in the middle of the ocean. And it ain't going to be easy.
Yeah.
Unfortunately, our kids are so sick today and they're sick with adult illnesses. I'm seeing 10-year-olds with BMIs of 40, pre-diabetics, MASH, and it's every day.
Yeah.
And that to me is almost more horrible than the child that doesn't survive an illness, because I feel so incompetent not being able to bend that trajectory no matter how hard we try. And uncomfortable in that these are adult diseases, not only creeping into the 14-year-old and 16-year-old, now to the 10-year-old. And we don't have any evidence-based guidelines as to, do I treat them like an adult? Is that the best thing to prevent the bad outcomes? Do I wait 10 years and start treatment? Do I wait 3 years? What do I monitor? There's just, the science is not there. And that
It's a
I
challenge.
think that's very hard. Trying to extrapolate adult data into a 10-year-old. And that is very hard. Now, why are you running for Senator? I am assuming you're representing Hanover County.
This race is for North Carolina District 7, which encompasses almost all of New Hanover County. And I am running for exactly the reason that you just mentioned. Our ability to improve children's lives in the exam room is very limited. So much of what they need is not a thing that we can provide in the exam room, which is why pediatricians advocate. We advocate for the availability of healthy food, of clean air and clean water, of safe outdoor spaces where children can play and exercise. of schools that are able to support them, of gun safety regulations or laws that keep them from being shot. These are all issues that go far beyond the boundaries of our exam room. And like you, I get frustrated not being able to address these things in a patient encounter. And I realized I have to look upstream. These are policies that are potentially harming our children and their families. And if I don't go where those policies are made and help make those policies better, then everything else I do is put on band-aids.
Yeah. And you're a big proponent of independent practices. Why are you a big proponent of independent practices?
First, I grew up changing the exam paper in an independent practice. My dad set up his practice in a very impoverished portion of Memphis, serving patients that a lot of other people were not serving. And that was his mission. And that's where I did my homework sometime. When I came to Wilmington, I joined an independent practice. When I went to Goldsboro, I went as a hospitalist for an independent practice. So I have seen the power of these practices really to transform the communities that they're in. They are laboratories for innovation. They are places that docs can really get to know their communities and figure out what works best for the patients that they're serving. And so I think we need to keep those practices going and give them the resources they need to serve the communities they're serving.
Well, from a policy perspective, what is the importance of New Hanover of having small businesses, which is what an independent practice is?
Absolutely. Again, an economy thrives when people feel comfortable innovating and starting businesses when they feel they have the support they need to compete successfully and try out new ideas and bring their best to the community. So to me, it is critical when I get into Senate to make sure that all sorts of practices are getting the support they need. As North Carolina is not unique, getting care into rural communities like the one I serve in Goldsboro is challenging. But that's where the need is. That's where the patients that I know and take care of are. And we have to make sure the practices can get into those communities and serve people that they understand, that they live near, that can get to them. And so that's critical.
Yeah. But just from an economic perspective, when someone starts a practice, they hire two or three people to help them. So now
Yeah,
there's three jobs in that community. And that has a ripple down effect throughout the whole community. That's most jobs in America are created by small businesses. So
absolutely.
if you start losing your pediatrician, your internal medicine doc, your OB doc, yeah, your family practice doc, not only do you not have access to care, a lot of small businesses are closing. Businesses, as you say, innovate and bring jobs to the community. And that is really fundamentally sound and needed for the community to thrive. George, you had a question.
With the hospitals, they seem to be taking over a lot of the independent practices. And they're big and they can do everything theoretically. But what I've seen, how many times I make referrals, people 8, 9 months, 10 months to get to see a specialist. I got to call up my friend and say, hey, can you do me a favor? I never used to do that. I think this is because they're taking over a lot of these solo practices and they just can't manage them. It's impossible to manage. We have a lot of little things.
Yeah. So there's two problems there, right, David? Problem number one is that concentrated markets are not good for our customers, or in your case now, would be for your voters. Doesn't matter what it is. That's why we don't get great service from cable company because every community has two providers and that's it. So there's no customer attention because you got to pick one or the other if you want to have an internet. The other problem in North Carolina expanded Medicaid, and within the law that they wrote, they gave the big hospital chains in North Carolina a big giveaway. So Medicaid in North Carolina, which I think is the right thing to do, is now going to pay the hospitals and the hospital employed physicians same as commercial payers. which is great. But now the independent practice that is more attached to the community doesn't get that payment, and they're not going to be able to survive. And they're going to have to go to one system and live by those rules. And unfortunately, the history of big hospital chains is that they don't like to invest in pediatrics. So they buy up practices and they close them. They close the pediatric emergency rooms. They close the pediatric wards. Many hospitals, rural, urban, and suburban, are losing their maternity wards. And so not only you lose some of the leverage, plus it's good for the patient to have a choice. Maybe they do want to go to the big hospital system. For the pediatrics or OB, it's all in the same building. The X-rays there, the pharmacy's there. Is very convenient. A Kaiser-like model. Or maybe they want to see David's dad, who saw their grandchild. And it's a one-person, I don't know how your dad's office is, but it's a one-person office. The staff knows you. Everybody greets you. You can always get in, and you feel very comfortable in a small office. And we need to have that customer choice. And the other damage that we do is for those that are paying for their premiums, like George and David and I, we all have high deductibles. And so when there is no competition, the hospital system and the health plan decide a visit's worth $400, and those $400 are going out of my pocket. And then next year, they increase their premiums by 10% because the medical spend was higher. And we just can't afford that. It's not sustainable for our middle class. I don't know. What are your thoughts and how do we fix that, David? Because it's just sad to see that people are working so hard paying $35,000 in premiums and they still have to shell out $5,000. And for a 99213, a simple visit, if they're owned by private equity or a health system, they're going to shell out $200.
Medicaid expansion was one of the best things to come to the state of North Carolina. And what I think was a tragedy is that the Republicans in charge of our legislature took so long to accept this essentially donation, this investment in our state from the federal government. And I'm thrilled that they figured out a way to do it. So to start off with, we are celebrating that we finally got this investment in our state's health and healthcare system that other states took advantage of much earlier. In office, I would be dedicated to make sure that just because people have Medicaid does not mean there's somebody there to take care of, right? So I am devoted to making sure that we get care into those communities, whoever can provide it. Obviously, in many of these communities, a privately owned practice, small private practice is the place that is willing to go in there and provide that service. So we need to look at exactly what sorts of supports they need, loan repayment programs, recruitment programs, possibly improved payment for serving underserved communities. We need to talk to all of these practices at risk and ask them, what do you need to better serve these patients? And then make sure that they have what they need, because that is what is going to contribute to the health of all of our citizens.
In New York, they had the big Medicaid expansion. It was called districts a couple of years ago. So they were really interested in independent practices that had the Medicaid lines of business and patients because you had a big roster, right? So they collect money, they did whatever they did. They got money from the government. They expanded Medicaid. They got more Medicaid patients. They did some quality stuff. They gave everybody some money. But all these they were all run by hospital systems. So the hospitals built all these big, nice, futuristic buildings. The patients multiplied, yet reimbursement is still the same. You should only do so much. Some of them are at $54 office visits, but you can't do business like that. Think about it. So what happens? Yeah, stop seeing them. Sorry.
Yeah. Yeah. That something has to change so that society as a whole benefits. and there's still pediatricians to take care of your children. And it used to be when I started this back in 1992, it used to be a problem in the rural communities. Now there's a shortage of all kinds of physicians in every community. And primary care is the one that has the biggest problems, even in suburban areas, because of the lack of payment for the services. And so people cannot maintain the lights on, even if they don't take Medicare and Medicaid. They just do commercial insurance. They can't. And those communities lose a small business. They lose access to care. And it's sad. We're one of the wealthiest countries in the world. We should be able to come up with a formula that meets everybody's needs so that people have access to care and young people are motivated to enter primary care and to start a business and be a part of the community that they grew up in. Nothing I think is more beautiful than when you achieve that dream.
Herb, I have good news to tell you. I have been teaching. I get medical students that come to my office every month. Been doing it
Yes.
for years. 5 of us do it. So we're about 50 medical students that rotate through our office every year. I've never encountered, usually I want to do surgery, I want to do anesthesia, I want to do radiology, neurosurgery, all these, nobody ever says I want to do peds. They'll do medicine, they'll do family medicine. Nobody does peds. I had one kid last year that wrote me today to say, because of you, I did pediatrics. And by the way, you offered me a job when I graduated.
Yeah.
And
That's a big win. That's a big
he's
win.
going to do it tomorrow.
Great.
Now,
So,
David, you're also very concerned about the intrusion into the exam room.
Yeah.
And why are you concerned about that?
So I think the most obvious example is the laws that are sweeping the country, restricting physicians and pregnant women's rights to determine how and when an abortion occurs. My opponent and the Republican supermajority here in North Carolina passed a restrictive abortion bill over the veto of the governor, which is one reason I need to win this seat, because this seat could break the supermajority and sustain the governor's veto. And we believe that we will have a Democratic governor in Josh Stein who would veto such laws. Our bill, as it currently stands, and we're seeing states that add one bill, come up with more restrictive bills as they move forward, which is a concern I have here. But as it currently stands, abortions are legal through the end of the first trimester. And they say that there is an exception for the life and health of the mother. I spend all day running into deliveries right now. That is primarily what I do. I work very closely with the obstetricians and I talk to them and I see moms whose health and lives are at risk. And the people who wrote this law, I don't think understand what it means for the people trying to save the lives of mothers. When I talked to one of my very good friends who's an OB, he's like, David, you don't understand. If a woman is losing a pregnancy and becoming septic, I have to prove that she's in sepsis before I can have her. If she is having a life-threatening hemorrhage, I have to prove that her hemoglobin is falling. Now, for us as physicians, the idea of letting somebody with sepsis or hemorrhage get to the edge of physiologic collapse before we act is horrifying, right? All we do is try to act as early as possible and not let life-threatening disease processes advance. But the way this law is being interpreted by practitioners around here means that even though there's this technical exception for the life and health of the mother, it is still putting mothers' lives and health at risk. So I think they need somebody in the legislature who can explain to them a little bit about how we think, because what we do is not cut and dried. It's not. It's an evolving process. And so these laws are getting in doctors' ways, trying to save people's lives. And that has got to stop. that is something, when I was a kid and my dad's friends were like, oh, the government's going to come into your office. It's not going to be the same. This is their worst nightmare. And I don't see it slowing down. I actually see it accelerating. And I think I got to get in there and help explain to these other legislators what we do as doctors and what that looks like and help them understand the unintended consequences of a law like this. The intended consequences are also problematic to me, but the unintended consequences are especially troubling.
I have so many thoughts when you said this because it's not only the government that's been creeping into the doctor patient relationship, which used to be sacrosanct. And I'm going to list them all. I know I'm going to offend a lot of people, but that's who I am. I'm going to start with maintenance of certification. I'm going to go next to prior authorization. I'm going to continue to when they force you to treat a patient who is depressed and with some suicidality as an outpatient with Lexapro until they fail before they put him in an inpatient unit. I'm going to talk about the obese kid that the father owns a business, pays his own insurance, and his plan doesn't cover GLP-1 receptor agonist. I'm going to talk about the EHR, how it's intrusion into our patient-doctor relationship. In the sake of, I'm going to talk about the DEA making me take 8 hours of continuing education when I never write for a narcotic. All I write for is amphetamines for the kids with ADD. I'm going to talk about he's a very nice man and he means well, but do I really need to do 2 hours of CME so I can identify human trafficking, so I can renew my Virginia license? No, I'm not the police. Let the police and other people do that work. Let me have a relationship with my patient and advise them to the best of my ability that day. What is the best thing they can do for their own life, their own family, their own child? Yet you have to balance that with a reality that every physician is not a great physician. And the government will always have the need and the responsibility to regulate the practice of medicine for the safety of the people that live in that state. And that balance needs to be very well thought out, very well thought out, right? This makes sense. This doesn't. Let's not try to intervene here. Let's not mess here because it's very important. If I see an optimistic, a sliver of silver in those clouds, is that maybe now they've pushed too far into the exam room and people like David are willing to run for office and inform the voters of why this isn't good for their health care and get to the policymakers and explain to them how all these policies have unintended consequences and how it's necessary that we, yes, protect the customer, the consumer, the patient, the people that vote for you, whatever they are to you. But we also have to minimize the burden, the regulation, the ask out of physicians because there's not enough physicians. And every time that I have to do one of these hurdles, it is a moral injury and it takes me away from the patient care, from the exam room where we want to be building relationships and moving forward. And so I think there's something great to be said is that, David, you're running for Senate and I wish you the best of luck.
Herb, I cannot thank you enough for that. It is clear nothing could be more important than people's health. And the people making the laws that affect our health do not seem to understand how we preserve and protect and promote health. So for me, I feel like it's time to go in there and help them understand it.
Hopefully,
I think, yes, George.
hopefully they listen to him. They usually don't. That's the problem.
But at least he's trying.
It'll work better if I'm in the room.
Showing up is half the battle.
Yeah.
Yeah.
So, David, how can people contribute to your campaign? Where can
Thank
they
you so
find you
much for
for your
asking.
position?
Our campaign can be found at hill4ncsenate.com. Four is spelled out. It's not the number four, FOR. So hill4ncsenate.com. We would love contributions. I think we're setting an example that can be followed throughout the country. If we see that pediatricians running for office are having an impact, I think we're going to get more bang for our buck. So please put in a buck to get some bang. We will be signing up volunteers we're uploading positions, we're uploading events. If you're in North Carolina, please come meet me, but you don't have to be here to contribute.
Great. Do you have any questions, George?
Oh, it's a very good episode. Interesting. Not about practice management, really.
It's not. It is about practice management
Yeah.
because the policymakers influence everything we do in the exam room. From you need a occupancy permit from the marshal to be able to open the building to your patients. That's where it starts. So everything that your legislators do impacts your ability to have a relationship with your patients and care for them. And that's why it's so important to be involved. And I could not do it, David. I have too much of a big mouth and I'm too opinionated. But God bless you for running for office. And I hope to see you at Wrightsville Beach sometime soon. And
Come
uh,
on down, Herb. It's great here.
it is a beautiful place. It's a beautiful place. And thank you for the time. Really,
Awesome.
again.
Thank you.
Appreciate it. Thank you so much, guys.